is Caroline, and I'm a nursing student at LR, and today I'm going to be your nurse. I'm going to do a full body exam on you. Is that okay if I do so?
Yes, ma'am.
Okay, so the first thing I'm going to do is a general inspection of her skin and her nails, which I would do that as I go through the checkoff, and I would do this with the mucosas too. But for her nails, I cannot see her nail beds, so they're done, and I can't see her toenail beds. So her skin is a light tan color. I don't see any visible lesions on her arms or her legs. Nothing abnormal. First, I'm going to look at the head. So the head is a round shape. I'm going to look at the scalp. So there's like no irritation. I have not seen any. I don't feel any nodules on her scalp, and no redness. Also, don't feel any masses, so that's good. Next, I'm going to look at the facial nerves, so the facial and the trigeminal nerve. Will you clench your teeth for me? I'm going to check the masseter and temporal muscle, so it's strong. I can't open her mouth. And then I'm going to ask you to smile. I'm going to ask you to raise your eyebrows, ask you to frown. So her facial nerve is normal. And then I'm going to do pain and light touch. So will you close your eyes and tell me, well, I'm going to show you this first. This is pain, and this is light touch.
Okay.
So close your eyes.
Pain. Light touch. 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 Pain.
Okay. Nothing abnormal there. And then will you close your eyes again? And I'm going to try to open them with my fingers. And I cannot do that, so that's normal. And then I'm going to tell you to put your tongue like this. And then I'm going to try to press it in. Alright. And her tongue muscle is strong. So I'm going to do the notes. I'm going to do the pre-auricular, and then, well, let's see, do it with these. Okay, I'm going to do the pre-auricular, and then the post-auricular, the occipital, the tonsillar, the submaxillary, the submental, the superficial cervical chain right here, and then the posterior cervical chain, and then the deep cervical chain, and then the supraclavicular, the infraclavicular, and then the, where's your arm? The lateral, and then the central, which is in her armpit, and then back behind her. Well,
I think it's a.
Oh no.
Thank you.
Okay, cut my video.
Sorry, guys.
My phone's about to die. And then the subscapular, which is under her scapula, right behind her. Well, you can't see that, but I would have her bra. She should have been. It's a video. And then I'm going to do the eyes. So I would look for ocular movement. I'm going to ask her to do, well, the 6 cardinal fields of gaze. You're going to follow my finger. I'm going to look for nystagmus. There's no nystagmus. And then I'm going to do accommodation and convergence, and there's no nystagmus on convergence, and her pupils accommodate. And then I'm gonna look at the conjunctiva. So it is pink, and that's normal. It's a light pink color, and then the sclera is a china white color. I'm gonna look at the. Do you have a flashlight?
Yes, potentially dry.
Mm-hmm.
Un momento.
I should have got that before.
Yeah, you're okay. Our kitchen has everything.
Does it work?
No. Oh, our kitchen has nothing. Just
I'm
kidding.
on time
Second drawer.
constraint.
Well, God said,
It
let
does.
there be light.
Okay. I'm gonna look at the corneal light reflex, and I'm gonna do it at the bridge of her nose, and I see it in both eyes. And then I'm going to look at the lids, and there's no lid lag, so I'm gonna palpate the puncta. There's no lid lag or anything like that. That's good. No extra fluid. And then I'm going to look at the pupils and do direct light reaction. So I'm just gonna get up here, and the pupils constrict when I do that, and then I'm gonna do consensual. So on this side, the pupil constricts on the other side, and then on this side, it also does the same thing. I don't want to blind you. And then I would do a visual acuity chart, which I've made. And then you're just going to read to me the top 5 letters.
B, C, F, E.
Oh, put one hand over your eye. That's my
you're
bad.
B, C, F, E, and D.
Okay, she got them all. So she would do this on both sides. When she would cover one eye and then do the other side. So you would have 20/20 vision if you get it all right. And I would use a Snellen chart, and then I would go in with. I don't have an ophthalmoscope, so I'm just gonna use a fork. I would go in and look at her red reflex. So I would go in here with on her left side with my left eye. I would come around and look for the red reflex on the temporal side, and then I would see the optic disc on the nasal side. It has more defined margins, and it is a brownish kind of yellowish color. And then I would look for the vessels. They are, there's 4, I'm very tired. There's 4 arteries to every 5 vein, so it's a 4-to-5 ratio, and the arteries, I should see bright red arteries, and then the veins are a dark purplish color, and they are wider than the arteries, and sometimes you'll see crossings. And then I would look for the macula, and that's more on the peripheral side. It is a brownish color. It has less defined margins than the macula, and the retina is an orangish color and a light brown color. And then next I would look at the ears. So I am going to do the acoustic nerve. I'm going to use this again. This is my tuning fork. So I'm going to strike it, and I would do the acuity. Well, no, I'm going to do this next. I'm going to do acuity. So you're going to close this ear with your finger and put it against your tragus. So like that. And then I'm going to stand over here and whisper. So I'm going to whisper 3 words and you're going to repeat them. Dog,
Ball.
Girl.
Girl.
And she got them all, so I would do this on the other ear too. And then I would do the lateralization test, which is what I need the tuning fork for, and that's the Weber test. So I would strike it right here, and then come behind and stick it over her head, and I would ask her if she can feel the vibration evenly in both ears and hear it. So can you hear it?
Yep.
Okay. And then I would do the air conduction to bone conduction test, which is the Rennie test, and I would strike the tuning fork and put it on her mastoid process, and this is bone conduction. So you're going to tell me when you no longer hear it.
I don't hear.
Okay. And then I would bring it right here, and she would tell me when she no longer hears it here. And this is air conduction.
There's here.
It should be a 2-to-1 ratio, so the air conduction should be twice as long as the bone conduction. And then I would do, I would do external structures. So I'm going to look at the outside of the ear. I'm going to look at the pinna and palpate and look for any lesions. She has her ear pierced, so she has one lesion on each ear. And then there's no nodules, no edema, and there's no redness and swelling. You don't have any pain when I touch your ears, do I?
Nope.
Okay. Next, I'm gonna go in and look at the canal, the ear canal, so the internal ear. I would use an otoscope, and I don't have one, so I'm gonna tell you what I should see. I would go over here and lift her ear up and back since she's an adult, and then I would look in and I would see the tympanic membrane, which is a grayish pearl color, and then I would see the long process, the short process, the umbo, which is a hump, and in the left ear I would see the cone light, which is at 7 o'clock in the left ear. And then, let's see, what I do next. The nose, I'm going to look at the external structure of the nose. So I'm going to feel it, and it is firm and stable, and it is midline on her face. And then I'm going to do patency. So she's going to hold one of her nostrils closed, and she's going to sniff in. We do the other one. And she sounds clear, so she doesn't have any like blockage. And then I would do cranial nerve 1, which is olfactory. I don't have anything for you to smell. I just forgot to grab.
Plant. Boom. Flower.
Ooh, coffee. But you don't know that.
Okay. Alright, they're closed.
Alright, so you're going to close one nostril, one nose, and you're going to sniff this. What does it smell like?
Coffee.
Okay. Do the other one.
Coffee.
Okay. So she got that right. And then I would do the oral cavity. So I'm going to look at the lips. Can you smile? They're symmetrical when she smiles. They are a pink color, a little bit chapped. The condition is a little bit rough. And then I'm going to look at the buccal mucosa. So, look at, where'd that first go? Oh, I hope my phone doesn't die.
Give it a little tap on the side and kind of get it together.
There we go. Hold on, I think we have. Oh, look how convenient this is.
What?
Popsicle sticks.
Hey, you can take it for that.
Okay, I'm gonna ask her to open her mouth. I'm gonna look inside. Her mucosa is a light pink, and her hard palate is a light pink, and her soft palate is also a light pink. she has, let's see, she has no cavities. Seems like she has 32 teeth. Will you close your teeth for me? Her top teeth come over her bottom teeth, so that's good. I'm gonna look for the Stensen's duct. It is up there, and I do see it. And then I'm gonna look over here on this side. Okay, will you say ah? Her tongue. Okay. Her uvula moves up and down, and her tongue is a light pink color, but it does have a thin coating of white, which is normal. And then, let's see what else. I know this. Okay, so will you swallow for me? Here. Yeah, it's a juice. Use some energy too. Okay. Swallow again. Okay. When she swallows, it's equal movement, so it's symmetrical. There's no problem swallowing. So I was checking the vagus and the glossopharyngeal nerve, and then I don't hear any hoarseness in her voice, so that's good. And then will you stick your tongue out for me?
Mm-hmm.
And will you move it side to side? Will you go up and down? I don't see any tremors or anything like that. We've already checked the strength of her tongue when we're checking for the facial nerves. So next I'm going to move to the neck, and the neck is symmetrical and in midline with her body, so it's in midline. It gets wider at the base, and that's what it should do. And then, that's the general structure. The trachea, I'm going to check it. It is midline and freely movable with her neck. And then for the thyroid, I'm going to ask you, I'm going to look for any enlargement with the thyroid, so I'll tell you when to swallow it. But I would just put some in your mouth and hold it, don't swallow it yet. So will you look down and to the right? Will you swallow for me? Okay. I don't feel any enlargements in the thyroid gland. I would do that for both sides, but for this purpose I didn't. And then I'm going to do the muscles of your neck, so the cranial nerve 11. Will you raise your shoulders for me? It is with resistance too. Will you let them down?
Oh yeah.
Try to raise them down. Okay. Will you do your head side to side? Okay. Will you do this way? Okay. Her muscles of her neck are strong. And working. So next I'm going to move to the chest.
Can you remove my shirt?
Yeah, that would be good. I'm gonna look at shape. So anterior to posterior is half of the transverse. And then I'm gonna have you, let's see, I'm gonna count your respirations. So I do 15 seconds and multiply by 4. So I'm gonna do 15 seconds. So about 18 respirations per minute, I would say. And then the type of respiration she has, she's more of a abdominal breather, so she breathes more through her abdomen. And then I'm going to auscultate, so will you turn around for me? Just kind of, yeah, there you go.
Is that okay?
Maybe just sit scoopies apart.
Yeah.
And just sit like this. Like this way.
Oh, facing?
Yeah.
Yeah, that's fine.
Facing the back of the chair. There you go. And then I don't have a stethoscope, But I would go basically. I would tell her to breathe in, and then I would just go down and around her back and listen. I would use the diaphragm of the stethoscope, and then I would do. I would do it on both sides, so bilaterally. I would listen for any friction or any strange sounds. And then we're gonna move to the cardiovascular, so you can get back up, and I'm gonna move these chairs back together.
No, you're good. Alright.
I'm gonna do radial pulse. So I do it. I think I'm gonna do it bilaterally, maybe. And I would do this I could do 15 seconds and then multiply by 4, so. It's around 70, which is normal. And then, I don't have a stethoscope, so I should have you lay on your back.
Go back. Okay.
So just lay on your back. I hate to tell you this, can you turn that way?
Oh, no,
I have to be on a certain side.
No, you're fine. That's on me.
Onto my back. And then you scoot back that way so your head's not like dying. There you go. And then I would do the apical pulse. So I would take my stethoscope and listen right here for a full minute. I would also auscultate and listen for S1 and S2, and I would do it at the, I would use the diaphragm of the stethoscope. Can't even talk. I would start at the second intercostal space on the right side border, and that's the aortic, and then I would do the pulmonic, which is the second intercostal space on the left side border, and then sorry, I have to touch your boob.
No, it's okay.
Permission. Huh?
You have my permission.
Okay. And then I would do the herbs auscultation, which is on the third intercostal space on the left side border, and then I would do tricuspid, which is the fourth intercostal space on the left side border, and then I would do mitral, which is on the fifth intercostal space on the midclavicular line. And then I would use the veil of the stethoscope and listen for any murmurs or extra sounds and do the same movement or pattern. And then I'm going to do the carotid arteries. So just stay with that. I'm going to feel one at a time. So I would feel for her pulse. And they are strong. They are 2 or 3 plus. And then they are bilateral and equal. I would also check for jugular vein distension. So will you raise your head? There is distension of the jugular veins, which is normal. And then I'm going to describe the peripheral pulses. So I'm going to do radial, which I've already done, and then brachial. So right here, can you hear that one?
Yep.
Feel for those. And I feel those bilaterally. And then I'm going to do femoral, which I'm going to go in her hands and feel. I feel those. And then dorsalis pedis, which is on the toes, which is right. Can you see me? No, you can't see me in the video.
Here we go.
Right here, but your legs would be straight.
Yes.
And then I'd look for the posterior tibialis, and I would do it bilaterally, everything bilaterally. And it's right about there. In both feet. And then I'm gonna do the abdomen, so I'm gonna look for contour. It is flat and tone, so contour and tone is flat. I'm gonna look for any scars or marks. So there are a few moles, which they don't seem to have any abnormal lesions or markings. And then I'm going to auscultate. So I would take my stethoscope and listen. Dude, I keep burping. I'm sorry.
Okay.
I would listen for any bowel sounds and do it in the quadrants. So I do it right here, right here. And I would just hold and listen. So there should be like 5 to 30 per minute. But I don't have my stethoscope, so I'm just going to use my hands for that. And then I would do palpation. So I would do light palpation, and you're just going to tell me if you feel any pain or tenderness. And I still do the zigzag pattern in each quadrant. I was supposed to do a circular motion, but I didn't do that.
Good.
So you feel no pain?
Nope.
Okay. And I don't feel any masses, so that's good. Now I'm gonna do deep palpation, and I'll use both hands. And you just tell me if you feel any pain or tenderness. I don't feel any masses so far, so that's good. Alright, and then I would do percussion. So I'm going to use these two fingers and percuss. Okay, and then I'm going to do your upper extremities, can't talk, musculoskeletal system, and do upper extremities so you can stand up.
Okay.
I'm going to ask you to raise your arms and then lower them and then in and out and then sit down and then your legs, raise your legs. Okay, extend your legs, yes. And then I'm going to ask you to raise your arms. So I'm checking muscle strength and then raise your legs. Okay. And then we kind of covered range of motion already with abduction and stuff like that. Spine. So you can turn around.
Sit away again.
Yep. And we bend over.
Yep.
I'm gonna feel for the position and the contour, so it's straight and in midline, so there's no curvature. And then I'm gonna ask you to bend back and then bend forward. I'll do this while you're standing up, but I don't want to make you stand up again. And side to side. And then twist. Okay. And then I'm going to ask you about your nervous system.
Okay.
Well, will you turn around?
Yeah.
So, what's your name?
Allie,
Okay. Where are you?
I'm at home.
Okay. What time is it?
Oh, my Atlanta, I would say probably like 11 o'clock.
Okay. And then I'm going to ask you to do some motor coordination things.
Okay.
So will you close your eyes and touch your hands to your nose? Okay. And will you put your hands on your lap? You can open your eyes now. And pat your legs and go back and forth like this. Flip them. And then do this with your fingers. So finger to thumb, both hands. And then will you stand up for me? Will you walk? Okay, will you walk heel to toe?
Mm-hmm.
She has good balance. Okay, and will you do on your toes?
Those calves.
Will you go on your heels?
Like a duck.
And then I'm gonna ask you to do, let's see, I'm gonna do deep tendon reflexes.
Okay.
So I'm gonna feel I would have a hammer, but I don't have one, so you rest your arm like this. I would take my hammer and your hand should pop up like that. And then I would do that was your bicep, this is your tricep.
Mm-hmm.
So I would hit it, just leave your arm loose. I'd hit it right here and your arm should go out like that. And then I would have you sit down and I would do patellar, and we should be at a higher space, but I'm not gonna try to get you on the table right
That's
now.
okay.
And I would hit you right there where the soft spot is, and you'd, yeah.
Okay.
And then plantar, this is where I would take the end of the mallet and go around here and your toes should curl. And then sensory is just the pain and light touch around your body.
Okay.
So with your eyes closed. So you tell me
Pain. Light touch. Light touch. Pain. Pain. Light touch. Light touch. Pain. Light touch. Light touch. Light touch. Pain.
okay. That is the end of the full body assessment.